Hello everyone, today we're going to talk about eyelid surgery. As we age, our eyelids stretch and the muscles supporting them weaken. As a result, excess fat may gather above or below your eyelids, causing sagging eyebrows, droopy upper lids, and bags under the eyes. Whether you want to improve your appearance or experiencing functional problems with your eyelids, eyelid surgery can rejuvenate the area surrounding your eyes. In this video, we will explain to you everything related to eyelid surgery, how the operation is performed, the expected result after the operation, and the possible complication of this cosmetic procedure. Our role today is to answer most of the questions regarding eyelid surgery. Today we have Dr. Park, who is a leading doctor at Lara Plastic Surgery. He's going to discuss with us everything about eyelid surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so that next time you'll be updated with our new releases. Hello, Dr. Park, how are you?
Yeah, thank you.
So can you introduce yourself to our audience?
Yes.
Hello, I am Ki-Soo Park, a surgeon specializing in eye surgery at the Lara Plastic Surgery Clinic.
So what is the difference between double eyelid surgery and upper blepharoplasty?
As you may know, the double eyelid refers to the extra upper eyelid. Generally, Westerners have double eyelids, but there are some Asians that do not, and double eyelid surgery is for those who want them but do not have them, or for those who want to revise their double eyelids. It could be either incisional or non-incisional. Ptosis correction, on the other hand, is indicated when the aged skin loses its resilience and shows lid ptosis. It is an anti-aging surgical treatment to fix what is both a visual and aesthetic problem. The surgical method can be classified according to the placement of incisions. Subbrow lifting places an incision under the eyebrow. Then there is upper blepharoplasty, which places an incision along the double eyelid line.
So to whom do you usually recommend non-incisional double eyelid surgery?
For those who are nervous about getting a scar, and those who want a more natural line, I recommend the non-incisional method. Generally, it is advisable for those with little eyelid fat and thin skin. In other words, for patients with eyes that can easily form double eyelids. The advantage of the non-incisional method lies in the short recovery period, and that it barely leaves a mark. But a major disadvantage is that there is a possibility of the eyelids reverting back to the original state.
So how about incisional double eyelid surgery? Who do you recommend to?
I recommend it to patients with thick eyelid fat or skin. In other words, to those whose double eyelids tend to easily revert, and for those with weakened levator muscles. These people suffer from a condition called lid ptosis. Those with severe lid ptosis tend to undergo simultaneous incisional double eyelid surgery. Incisional double eyelid surgery is fit for those who want a more pronounced double eyelid and who are worried about reverting back. On the other hand, there is always the risk that the scar tissue can form and the recovery period will be longer.
Okay, so can you also explain what is actually anti-aging eyelid surgery in details?
Subbrow lifting is recommended when the double eyelid is simply slacking, when its original shape is preserved, and also those who have relatively thick eyelid skin, when incised along the double eyelid line. The result may appear quite unnatural in this case also. Placing an incision under the eyebrow can raise the lid more naturally. Furthermore, the eyebrow allows for a longer incision than along the double eyelid line. So for those with severe ptosis in the periorbital area, subbrow lifting can be more advantageous. Upper blepharoplasty is for those who want to modify the height or shape of the double eyelid line, and people who have weakened levator muscles and suffer from a resulting ptosis tend to undergo simultaneous incisional double eyelid surgery.
So Dr. Park, which type of canthoplasty do you mainly do in Korea?
Unlike Westerners, many Koreans have what is called the epicanthal fold, which covers the medial border of the eye. This fold makes the eye appear narrower, and depending on the angle of the fold, you may give a somewhat edgy impression. To improve this, epicanthoplasty is frequently performed along with double eyelid surgery.
So what kind of person is not suitable for epicanthoplasty?
or those with mild epicanthal folds are an example, and also those who have a short distance between the medial borders of the eye can appear to have an overly centered eyes after epicanthoplasty. If you are one of the above, but nevertheless want to widen the vertical length of the eyes, I would recommend lateral canthoplasty.
So what is actually a lateral canthoplasty? Is it a must to do it with epicanthoplasty as well?
Lateral canthoplasty is a surgery that lengthens the eye. In the lateral direction, it does not have to perform together with epicanthoplasty. It is frequently performed when there is enough space between the orbit and the bone surrounding it.
And also, what is a lateral Holtz? How is it different from lateral canthoplasty?
Lateral Holtz, aka lateral canthopexy, when the patient's impression appears sharp due to a raised outer corner of the eye. We perform the surgery to make the slant 45 degrees and make the patient appear more softer. Those that desire large eyes sometimes undergo lateral canthoplasty and Holtz at the same time. We call this dual canthoplasty.
Is it difficult to redo the work from other doctors?
Reoperation can usually be performed. However, once a scar tissue forms, the adhesion has to be removed, which prolongs the surgery and also requires more delicate hands, and with multiple incisions, the eyelid skin runs out, making surgery quite difficult.
So for our last question, how long is the recovery period for double eyelid surgeries?
Generally, for disinfection and follow-up purposes, we advise visiting the hospital 1 to 2 days after surgery. And depending on the surgery method, the stitches are removed 5 to 7 days post-surgery. Everyday life can be recovered after stitch removal, but it takes about 2 weeks for the swelling to subside. In certain patients, it may persist up to 1 month. The final result of the surgery can be assisted about 3 to 6 months after the surgery. Light makeup can be done starting on the day after stitch removal, but eye makeup can stimulate the skin of the eye in a bad way, so it is advisable to do it at least 3 weeks after the surgery.
So that's it for today. Thank you so much, Dr. Park.
Yeah, thank you.
감사합니다.
네, 감사합니다.
Today we learned many things about the procedure, and the doctor explained in details everything related to eyelid surgery. Thank you for joining us today at CloudHospital TV. If you have any questions or comments, please leave them below and we will respond to you as soon as we can.